Hello, ladies and gentlemen, and welcome. This is one of the most important chapters of this entire course, as a matter of fact, namely because this has repercussions on most of the other courses that we have in our program here at Kaiser University. So this is one you're going to want to tune into. We didn't have all of the time to go through this in class, but that's okay. I want you to take your time with it. And forewarning for you now, we're going to get to a point in this slideshow here where I want you to make sure that you complete an assignment for me. So that's how I'm going to know. I'll tell you when, where, how, but it's only going to be at a certain point. I'm not going to tell you where that is, but you got to make sure that you listen to this. This will be one of your lab grades. So make sure that you go through this, pay attention to it, at least, get some of the stuff right in on the slides. You guys have the blanks, and we'll go from there. But without any further ado, let's figure out what the whole thing is about with exercise and its impact on your psychological well-being. Well, let's talk about just some basic things about society nowadays, right? Very hectic, lots of stress, a lot of demands on people each and every day. More people than ever are really feeling the ill effects of this. We've talked about it at length in class. Across people's lifetimes, 25% of people will have anxiety disorders and 20% will experience some type of depression. So that's 1 in every 4 people with anxiety and 1 in every 5 people with depression. That's a pretty strong stat. It tells you that a lot of people are in need of ways to effectively manage this. Now, this book is a couple years old. There is a new edition that just came out. We didn't get it in time to update it for this course, but next time I teach it, I should have it. But by next year, 2020, they're saying that depression will be second only to cardiovascular disease as the leading cause of death and disability. Maybe more indirect than direct because it leads to other poor lifestyle choices, but you can see how depression, anxiety, those are going to really negatively impact people's lives. The cost of it, about $45 billion a year. It is something that really needs to be combated against. And that's what brings us to this chapter, because exercise is the name of the game. Exercise can positively influence feelings of well-being, and it can help to decrease anxiety and depression. This is not groundbreaking news for you, but this is what we have found. This is what science and evidence actually shows too. Epidemiological data shows that physical activity is positively associated with good mental health in the U.S. and Canadian population. So the other 4 out of 5 or the other 3 out of 4 people that are not experiencing some of those issues, there's a very good chance based on this epidemiological data that they are more active than the people that are experiencing it. Here in the book, we talk about 6 dimensions of well-being. The first 3 here, self-acceptance, so having a positive view of oneself, that's an important one. A positive relation to others is another component of well-being, so having trust, caring, having mutual care, you caring for someone, them caring back, and empathetic relationships, so being able to relate with people and understand them. Autonomy, self-determined with intrinsic motivation and self-reference standards, so things that drive you to be independent, that you do things on your own, you do things for yourself. Environmental mastery, so feeling some kind of control over the environment and being able to control your own destiny to some sense and fulfill your own personal values. Personal growth, so always growing, develop, so self-fulfillment over time. And a purpose in life, a directed efforts towards purposeful goals for a living. So those are the 6 dimensions for well-being. And again, we're not on exercise here yet, but exercise can really help us get to a better place to really enhance these 6 dimensions and make sure that they're doing what they need to do for us. So a couple stats, some first things for you to fill in. Exercise and the reduction of anxiety and depression. Again, let's look at just the impact of the workforce and hospitalization. Mental health problems account for 30% of the total days of hospitalization in the United States and about 10% of the total medical costs. So all the money that we spend, and we're talking billions of dollars, a lot of it is influenced from mental health reasons. Now, there's no cause and effect relationship, but we have seen and evidence strongly supports that there is a good relationship, not necessarily cause and effect, but a positive relationship with reductions in anxiety and depression. So it's important that you stay regularly active. Now, a lot of times we talk about aerobic exercise and how that has a tremendous benefit, and it does, don't get me wrong, but that is not necessarily the only thing that you can do. So it doesn't have to be high intensity or even low intensity aerobic. Other things like strength training and yoga, they also can provide positive effects. So just good things for the body are going to lead to good things for the mind. Let's talk aerobic versus anaerobic exercise. Next month in particular, we'll go over this a whole lot more, really look at the different types of exercise and different systems in the body. But just quickly, just so you have an idea of what we're saying here. Anaerobic activities, these are short-term, short burst activities that do not involve the transportation of oxygen. So activities like weightlifting, baseball is one, because baseball is a lot of start and stop, very explosive short-term activity for a short period of time, whether you're a fielder or a batter. You know, when you swing the bat, that is a quick burst of energy. You're not using oxygen for that. Or even if you hit it and you have to run the bases, the distance is so short, the amount of time is so short that you don't ever really use oxygen. It's anaerobic activity. Aerobic exercise is longer term activity that increases pulmonary and cardiorespiratory system activity. So your lungs and your heart are working. This takes more time. Things like cycling, running, swimming, etc., so on and so forth. So those are the different types of exercise. And there are different effects. We have short-term effects from exercise and we have long-term effects from exercise. And we're going to get into a little bit of both, and there's benefits on both sides of it here. So those are acute effects, the things that happen in the short term. We've talked a lot about state and trait anxiety. Well, let's talk a little bit about state anxiety. So aerobic exercise is associated with lower state anxiety and higher tranquility scores. So a little more peacefulness, a little more zen. Post-exercise reductions in state anxiety can return to pre-exercise anxiety levels within 24 hours. This statement will come up again and again here in this chapter. So they kind of reiterate it over and over. So what that tells you is the effects are pretty short term, and they are not the be-all end-all to solving your problem. So if you're in a bad mood or you have a lot of anxiety, this is not going to fix your problem. It might make you feel better for a little while, but within 24 hours, and sometimes as short as only a few hours, you can get back to your normal levels of anxiety. So that's not such a great thing, but it does help, and it is healthy. So something to keep in mind. What they have found specifically when it comes to the recommended intensity ranges, and it's a very, very wide range here. Pretty much almost anything that you do is going to put you somewhere in this range, unless you're going crazy or if you're, I don't know, walking very slowly. But the exercise intensity between 30 and 70% of your max heart rate, that appears to be associated with the greatest reduction in post-exercise state anxiety. So just getting enough exercise, get your heart working just a little bit, anywhere between 30 and 70% of your maximum. That's going to be good for you. Moderate intensity, so kind of somewhere in the middle of that, produce the greatest positive effects in affective responses. When you hear that word, it looks like affective on there, but it's actually pronounced affective in this context. And what it's referring to, your affect, is like your mood, your emotional state. So your affect. So if it has a positive effect in your affective response, that means that you are you have a better, more positive, friendly disposition. You see the picture here I put on this slide. That was Grumpy Cat, but look at him. He's happy now. He must have just exercised, right? He has a positive affective response. So rather than his negative affect that has turned this meme into an internet sensation, who knows? Maybe this is even too old for a reference for some of you. But once upon a time, the whole Grumpy Cat thing was a big thing on the net. But look, he's happy now. And so this is kind of what we're talking about, a positive effect on his affective response. And this happens in people as well. Even low intensity. So let's say you can't get that high. Look, something is better than nothing. You will see improved affect even with lower intensity exercise. A couple more acute effects here for anaerobic exercise, things like weightlifting. Mood enhancing effects are evident about 30 to 50% max heart rate. Again, heart rate is not always necessarily the metric we're looking for when we're doing anaerobic exercise. We're typically looking at other things, but heart rate response happens regardless, right? Like, because our body all works together. So even if you're not working aerobically, you're working anaerobically, your heart is going to pump faster. It's going to be working harder. So so you'll see even a 30 to 50% increase. That does have some positive acute effects. Although acute exercise is no more effective in reducing state anxiety than quiet rest or relaxation, the effects do last longer. So there's multiple methods of helping to calm your nerves and helping with anxiety, in particular state anxiety. You know, we did an exercise in class with some guided imagery. That's a relaxation technique. Rest or relaxation. Those are great as well. Just as much of a benefit. However, what we're saying here, exercise, it lasts longer. It has more of an effect for a longer period of time. So that's why that is an effective strategy. For people that have a lot of anxiety, it's very beneficial. Okay, so that's something to keep in mind. If you have a lot of anxiety, exercise is great. But it's not just for those who have a lot of anxiety. It's beneficial even for people who have lower levels of anxiety. It's going to help you regardless with your mental wellness, especially with combating anxiety. All durations of exercise significantly reduce it, although larger effects have been found for periods of up to 30 minutes. So something is better than nothing, but when you have the opportunity to do exercise for longer than 30 minutes of time, especially under moderate intensity levels, which, look, guys, this is what is recommended anyway. The American College of Sports Medicine recommends that you get 150 not hours, sorry, 150 minutes per week of moderate intensity exercise, which equates to, if you're going to break it down nicely into chunks, 30 minutes a day for 5 days a week. That's a moderate intensity. That's 30 minutes. Great benefits, not just on your health, but also on anxiety levels. So remember that. Great method for helping to reduce anxiety. Again, 24-hour lasting effects potentially, maybe as short as 4 hours. So it's not the be-all, end-all. It does help with muscle tension. We know that stress does cause us to increase muscle tension. So using exercise can help to reduce that as well. Reductions in anxiety are not necessarily tied to the physiological gains resulting from exercise bouts. So when we talk about what the benefits are physically and what happens, yes, there are some, but they are not necessarily related one-to-one as to why it affects anxiety. So it's not necessarily the change itself. It really has to do with the process. The anxiety reduction after exercise occurs regardless of intensity, duration, type. So the moral of the story here, gang, exercise, exercise, exercise. It is good for the mind. Aerobic exercise specifically can help with reducing anxiety, similar in the magnitude or the strength of the effect to other commonly employed anxiety treatments. So the other things that you go to doctors for. Exercise is a great way to go. Anxiety reduction after exercise occurs in all types of participants, so it doesn't matter if you're a man or a woman, doesn't matter if you're super fit or you're really unfit, active, inactive, an anxious person, inanxious. None of that matters, young, old. Look, it's good for you. Keep doing it. Those are all the acute effects. Let's talk long term. So what can happen? How can this benefit you over the long span of time? We know that physical fitness in general, so the state of being physically fit, is associated with mental health and with mental well-being. Exercise is associated with the reduction of stress emotions like state anxiety. Okay, great. We've established that already. But anxiety and depression are common symptoms of failure to cope with mental stress. And kind of like what we're talking about with just, long chronic effects of exercise, chronic anxiety, chronic depression are things that also take shape over time. And exercise has been associated with a decreased level of mild to moderate depression and anxiety. So even just more than the short term, by making it a continuous part of your life, it can have better effects long term on these issues as well. It's also, long-term exercise usually is associated with reductions in traits like neuroticism, so somebody who's neurotic and panicking and always worried something is wrong. longer term anxiety, not just state anxiety. Appropriate exercise results in reductions in various stress indicators such as neuromuscular tension, resting heart rate, which you want that to come down. You don't want an elevated resting heart rate. And with reducing stress hormones, which again, stress hormones, while they are beneficial in a truly stressful situation, the fact of the matter is if we're just anxious all the time, we're releasing them constantly and they can wreak havoc on the body. So more and more exercise being able to inhibit that and lessen the likelihood that that stuff is out there floating around in the body is going to be to the benefit. Now, clinical opinion based on what we've seen in science holds that exercise has beneficial emotional effects across all ages and sexes. Physically healthy people who require mood-altering medication. So even if you're on meds, now that's important to know. If you're working with any clients that are on any medications, you certainly want to know what those are because there are some do's and don'ts. But those are things that we'll talk about more in another class. What you need to know now is even if they're on those medications, they can still safely exercise. However, that's why all those forms that someone has to fill out when they first come to the gym are important because you'll want to get that clearance from the doctor and get some recommendations as to some things that they can and cannot do so you can help them with that program. So that was a lot of stuff on anxiety. Let's talk about the result on depression specifically. There is a moderate relationship between exercise and depression. Again, correlation, not causation. So there's a relationship. We've seen improvements. However, just because you exercise does not mean that you will not be depressed. So it's not a causal relationship. It has been shown, however, to be as effective as psychotherapy in reducing depression. So if somebody's feeling the blues, exercise and starting to put some of that back in your life is a beneficial choice. Positive effects seen, just like we saw for anxiety, across all groups, age groups, health status, race, socioeconomic status, sex, you name it. It's good for everybody. Aerobic, anaerobic, both can help reduce depression. So it doesn't matter what type of exercise modality you pick. If you like to run, you like to lift weights, you like to take an exercise class, pick your poison, whatever you like. That's going to help with reducing depression. Severe depression. Clinical depression, something that is really bad. This will also usually require professional treatment, which might include medication, psychotherapy, perhaps something even as extreme as electroconvulsive therapy, or a combination of these with exercise as an adjunct. So exercise is not a substitute for those. We know exercise does have benefits, but for someone with severe depression, they need a lot of help from a lot of different areas. So you can't say, oh, just exercise more and that'll solve your problems. No, first of all, we're not doctors. We can't make those calls. We don't diagnose these conditions, so that's really outside of our scope. But second of all, this is severe. This is clinical. This is something that requires more hands on deck, and so exercise can be thrown into that mix, but it is not the be-all, end-all. Exercise does, however, produce some large antidepressant effects when the training program is at least 9 weeks long. So there's that whole chronic idea. So if the exercise program is 9 weeks long, what they're seeing is that it actually has similar effects to antidepressant medications and antidepressant effects on just your mood in general. Doesn't matter how fit you are, you will see reductions in depression regardless of your fitness level. 3 to 5 times per week produces significant reductions in depression compared to once a week. Again, if you only can do once a week, then do once a week, please, by all means. However, if you're looking to maximize the benefits, 3 to 5 times a week, which again sounds a lot like the ACSM recommendations. So not only are those recommendations great for the body, right? 3 days a week, 5 days a week, 150 minutes a week, however they put it, which we'll get into that next month specifically, but that's great for the body and also great for the mind. Maximizes the benefits on helping to reduce or alleviate depressive symptoms. As for mood, mood is a little different than depression or anxiety. Mood refers to a host of transient, so that's moving, fluctuating affective states. So again, those affect how your disposition is, how your mood is. States that can be positive or negative. So feeling elated, which feeling really excited or happy, feeling very sad and down and blue. These are all emotions. that you have. So we can see, now you know what mood is, we can talk about what exercise does to it. It has some positive effects, can help improve positive mood regardless of the number of negative and positive affective states in a given day. So no matter what kind of day you're having, good day, bad day, a little bit of exercise can certainly help to at least crank it up a little bit, make it a little bit better. Exercises with choice of exercise mode scored lower on negative affect than exercises having no choice. So that's important too, having options, being able to make sure that people who are actually exercising the way they want to exercise and doing the things that they want to do. Perception of fitness may be responsible for part of the mood-enhancing effects of exercise, so as opposed to the actual level of fitness itself. So again, we talked about regardless of where you were fit-wise for some of the other areas when we talked about anxiety and depression, but here, bigger responses for people that felt like they were more fit. And again, feeling like you're more fit is not the same as being really fit or being really unfit. It's all about how you feel about it. Like someone might be super fit, but they don't feel like they are. So maybe the benefits aren't as great. Whereas somebody might look a little flabby to you, but they feel great about their fitness and activity, and they're going to have better emotional responses to exercise. It's all about that perception. A couple different ways of explaining it. Here is the physiological explanation. So how exercise enhances psychological well-being. Let's look at what happens physically, because this is one way science has tried to explain it. We see increases in blood flow to the cerebrum, to your brain. So more blood to the brain, that's something that physically occurs. Also, when it comes to your neurotransmitters, those chemicals that get released from the brain, these are all positive hormones that come out. Norepinephrine, endorphins, serotonin. These get released, so that's a physiological response that is possibly an explanation as to why exercise is good. Increase in maximum oxygen consumption and delivery of oxygen to cerebral tissue. So again, more oxygen in the body, more oxygen to the brain, less muscle tension, and actually has some positive structural changes in the brain. So it helps make that brain stronger, better, faster, more efficient. These are all physiological things that happen as a result of exercise. And some scientists have really argued that these are some of the reasons why exercise impacts our psychological well-being. On the other side of it, just looking exclusively at the mind. So that was all things happening in the body. These are things happening in the mind. So these are more theoretical, more conceptual. When you exercise more, you have an enhanced feeling of control. So you feel like you're more in control of your body, of your environment, of just your mental state. You feel competent. You feel a sense of self-efficacy, like you are accomplished in something. You can do something well. It helps with positive social interactions, especially if you work out in groups. You're having those great positive relationships with people as you're there. Improves self-concept and self-esteem, so just better belief about what you are, who you are, and how you feel about yourself. And there's lots of opportunities for fun and enjoyment. Again, these are all subjective. They all happen in the mind, but these are all things that have been documented and recorded. So these are the psychological explanations as opposed to the physiological explanations. Interestingly enough, we've seen some great responses on actual physical diseases. Exercise has been linked to some positive effects on, read it here. I'm not going to read them all to you. You can pause the video here and take a look at it. But, HIV, cancer, that's great. Like, those are pretty serious conditions. If exercise is having a positive effect on those people, it's a strong argument as to why someone should be doing it. Now, we mentioned this just a moment ago, looking at changes in personality and cognitive functioning now. Exercise is related to self-concept, self-esteem, self-efficacy. Regular exercise seems to be related to increased self-esteem. And esteem enhancement effects of exercise are especially pronounced in people with low self-esteem. So people with really low self-esteem, get them working out, get them exercising, get them feeling competent about how they're doing things and what they're doing. And guess what? They're going to start feeling better. They're going to have tremendous response. An earlier study from '86, positive changes in self-concept and self-esteem were associated with participation in physical education and directed play. Look at that. And this is something that's being removed from schools, and you are seeing more suicides. We're seeing more depression and more medications going out, and less physical education in school. Kind of weird. Less play, less people being outside. Well, maybe we should get more of that, especially if you're a parent or you're working with kids. You can see the importance of it. Exercise programs designed to enhance self-esteem should emphasize experiences of success, feelings of increased physical competence, and attainment of goals. And that's what sports and those types of activities do for people. We're going to go with an important keyword here, an important key concept, and that is hardiness. Now, hardiness is a personality disposition that involves a sense of personal control, commitment, and purpose, and the flexibility to adapt to unexpected changes. So hardiness means that you can pretty much be strong through many conditions, but you can also roll with the punches, and you have a direction of where you want to go. A hardy personality and exercise in combination are more effective in preserving health than either one alone. So having a hardy personality can be a thing without exercise, but having a hardy personality and exercise as being part of your lifestyle, great combination in helping to preserve mental health. Let's look at how exercise can help with our thinking, with our cognitive functioning. They found that exercise programs conducted over long periods are associated with moderate gains in cognitive functioning. So you actually think better if you're someone that exercises regularly. Acute aerobic exercise increased executive cognitive functioning in planning and problem solving. So look at that. Even if you just did a small bout of some aerobic exercise, they have found that it has positive impact on your brain when it comes to executive cognitive functioning. Again, this whole aerobic conditioning, which brings in oxygen, right? Brings more oxygen into the lungs, gets more oxygen out to the rest of the body, and of course to the brain. So that aerobic physical activity has a positive effect on your thinking and on other brain functions, so cognition and brain function. Executive central command seems to be the most affected by aerobic exercise, so really the full functionality of your brain. Acute exercise increased that cognitive function in the form of working memory, only for people that were low in working memory. So if somebody doesn't have a good memory on things normally, they saw benefits, but if somebody already does, well, then exercise doesn't have as much. But interesting research finding. Now, I want to stop here for just a second, just because I kind of breezed past it. But if you're following through in your notes, which you should be, I want you to go back 7 slides from now. Now, I don't know how long that is in the video because I'm recording this live as I go. But 7 slides beforehand, after I gave you the physiological and the psychological explanations, I would just want you to send me an email. This is going to be due by next Tuesday. So by Tuesday, week 3, because we do have Monday off for President's Day. By Tuesday of week 3 at 9 a.m. sharp. I'm not going to accept it. It will be a 0 if it's at 9:01. I want you to email me the rest of what I wrote in. So it was written in green here in the presentation you're watching, but give me the explanations of what I had there, okay? The psychological explanations and the physiological explanations for how exercise enhances psychological well-being. Just write them out, type them up. Here you go, Mr. G. Watch the video. Found it at the so-and-so mark, maybe 20 minutes or whatever it was, that the 20-minute mark is somewhere around there. But go back to those. Just fill them in. Write me an email and have it in by Tuesday, week number 2. And that will give you 1 lab grade. And if you don't do it, then you get a 0. And we don't want to accumulate many of those because they will start to sink your grade. Labs are worth 20%. So when you're not in class and you're not completing a lot of the activities that we're doing as we go, they add up. Don't miss this opportunity here. Back to exercise and cognitive functioning. ADHD now. Moderate to vigorous physical activity. Guess what? That helps kids with ADHD, especially on their executive functioning skills. Integrating that physical activity into the classroom produced increase in children's intrinsic motivation, perceived competence, and effort. And then they're not talking just about exercise. They're talking about towards their schoolwork too. So all this effort we've put in preparing kids for more test time, more in-class instruction, and we're taking away physical activity, we're working against their brain's likelihood of success. It's really not a great thing. How about cognitive functioning for older adults? We know that as you get older, sometimes your cognitive functioning and other areas start to break down. But fitness training, believe it or not, does have beneficial effects on this area for those people. For those tasks that involve executive control, like planning, scheduling, working memory, and task coordination, these areas are the most significantly impacted when they participate in cardio. And for old people, you got to worry about conditions like arthritis and osteoporosis. You don't want anybody to fall. So some cardio in the way of walking, some cardio in the way of perhaps being in the pool, doing an aerobics class in the pool, or just some light swimming. Guess what? Those are great modalities you can go with that are going to help increase these areas. When you throw in some strength and flexibility, which you should, then there's an even greater positive effect on cognition than just doing aerobics. So you got to get a little bit of everything. Effects appear to occur more in females than in males. No explanation given here, but older females do struggle with some additional issues than men in terms of at least bone health. So maybe that has something to do with it. If I was guessing, that would be something I'd like to explore via research, but more in females than males. 30-minute duration, that seemed to show the greatest effects. And from a physiological perspective, cardiovascular exercise appears to protect the brain against the normal effects of aging and helps repair or restore the aged brain. It makes sense based on some of the other things that we said earlier, right? Physiological explanations, more oxygen in the body, more oxygen delivered to the brain. We're keeping the brain healthy. We're giving it some oxygen to use to keep functioning better. So it makes sense that it wouldn't break down quite so much. How about sleep? We talk about exercise and sleep is really crucial. What we found, effects of exercise on enhancing sleep are not as compelling or as large as everyone would believe. That doesn't mean you shouldn't do it. But the effects are small, but they're noteworthy. Exercise does produce small increases in total sleep time, and getting the right amount of sleep is still very important into overall health and overall functioning. How about quality of life? I think for everybody, but you see a picture here of old people doing a conga line, looks like inside a retirement home. That's better quality of life than just sitting around doing nothing, wasting away. And exercise can really help with that. So quality of life, the definition here, it's a person's behavioral functioning ability, being able to do your everyday stuff and live long enough to keep doing all of that stuff. People that are more active, guess what? They have a better quality of life. Positive effects of physical activity on quality of life can be grouped into 4 different categories. So here's what it does for you that helps to improve that overall quality of life. So number 1, better physical functioning. You can move better so you can get around and do things more. When it comes to a subjective sense of well-being, that also seems to increase. So just by being more active, people seem to enjoy things more, and they've got a better, more positive mood. All things we talked about earlier in this discussion. Experiencing peak moments, so some of those experiences where things get heightened as a result of it, and then more personal meaning. Just things mean more to you because there's more that you're engaged with. College students, here's an interesting one. Again, this is more for traditional college, but bears mentioning, I think. College students participating in an endurance conditioning program report a significantly higher quality of life than do non-exercisers. I'll tell you this. There's also higher graduation rates that we've seen in a lot of studies, things that I looked at in students that are more engaged on campus and that particularly participate in online student recreation, all that stuff. Higher graduation rates, better life, better outcomes, actually being able to maybe pay off some of the debt they took in by going to school in the first place. So get active. And older adults, I think we've said enough about. More psychological benefits here, more self-esteem, you enjoy things more confidence, your mood is better, physical and psychological stress, those will get decreased, anxiety, depression, those decrease. So I can't stress it enough. Exercise, exercise, exercise. Great for the body, great for the mind. Here's a little stuff on the runner's high. You see a picture here. That is me in the blue, and those are 2, 4, 6 of my students. I had 9 students that were a part of our initial Tough Mudder team. That was something we did a couple years in a row, way back. This was the 2013 crew. But we ran a lot because we were getting ready for the first Tough Mudder. And I can tell you I've experienced this, the runner's high, which is a special case of exercise and psychological well-being. So the runner's high, as they call it, if you're not a runner, you have no idea what this is. So I'm going to explain it to you. If you have, well, then listen to it and see if it lines up with your experience. It is a euphoric sensation, so you feel really good, a sense of euphoria, usually unexpected, of heightened well-being and enhanced appreciation of nature, transcendence of time and space. You're just kind of out there, just taking it all in, enjoying it. Everything feels beautiful. You feel great about yourself. You feel great about your outside and your surroundings. Preliminary results out of Germany provide initial evidence that there is a chemical change in the brain related to this. So they've tried to study it and measure it, and it looks like there's some science to back it up. We used to have to run a lot. This was after a particular run. I was taken out in the rain. It was pouring rain. We ran like 7 or 8 miles outside in the middle of the day. Man, it felt awesome though. It felt great being with a team and just being outside. Even though we were soaked, we felt pretty good. This was down at my Daytona Beach campus where I was previously. More on this concept here. Characteristics conducive to the runner's high are few distractions, cool, calm weather, and low humidity. Not something that we had the benefit of, but at least with the rain, it made it feel a little better. And a duration of at least 30 minutes, and we were out there a while. It was more than 30. Runners differ regarding weather and how often they experience this high and may require slightly different sets of conditions to get it. That was probably the peak of my running in life, was when we were getting ready for that race, and then the following year as well. So I got to experience it at least a couple of times around, and I recommend it. If you're someone that likes running or can withstand running and maybe learn to love it, I recommend you get out there, because feeling this runner's high, it feels good. You can see why somebody might chase after it. How about mirrors? So we're getting into a lot of like random concepts here. But if you look in a lot of gyms, a lot of weight room areas, and also in group exercise studios, you'll see a lot of mirrors. Well, here's some arguments as to whether you should or should not have mirrors in an exercise setting. So women who are generally sedentary and have a negative perception or poor perception of themselves, they tend to focus more on their own physique. So they're very insecure and uncomfortable with it, which appears to result in increases in negative affect, since this heightens the perceived discrepancy between the actual and the ideal physique. So what this means is if women in particular who don't feel so good about themselves and don't have a good sense of themselves, regardless of how they look to everyone else, okay, because that doesn't matter. This is about how they feel. When there are mirrors around them and they can see themselves, all it's doing is reinforcing those negative feelings they have about themselves. And so in those circumstances, mirrors are not beneficial for that group. There was not a negative effect on social physique anxiety with women who are generally more active and confident in their ability to exercise. So if they were confident in their ability and they felt good about themselves and they thought they looked good and all that, guess what? Mirrors, not so bad. They were a pretty good addition. We should say, and I think dudes in general, no matter what they look like, they just like having the mirror and flexing in front of it. So I guess that's probably something to have if that's your population. Let's look at exercise as an adjunct to therapy. Despite the psychological benefits of exercise, this is important here, goes back to what I said earlier about not being a doctor. This is not something that should be used in all cases of depression, stress, anxiety, or any other emotional disorder. So usually it is recommended to do more of it. But this is not, oh, you don't need that medicine. Oh, you don't need to go see that doctor. Just work out more. That's not the solution here. So make sure you know that. This is not the be-all, end-all solution. Can it help? Sure it can. Science does support that. But look, let the doctors talk about it, not us. We can just usually recommend it as an adjunct, as an addition to other types of therapy. Now, if you are going to use it as therapy, and you're working with a client that's, depressed and down, one of the things that's good to know, look at the client's exercise history. Figure out what they've done, what they liked, what they didn't like. This will help inform your process of creating a good program that's going to reinforce behaviors rather than punish behaviors and make people not want to do it. You want to provide a precise diagnosis of the psychological problem. Well, that doesn't come from you. That comes from a doctor. So knowing what's there can help inform that process. And then use an individualized exercise prescription for duration, intensity, and frequency of exercise. This is not true just for people dealing with any kind of psychological disorders or psychological problems. This is true of all of your clients. This is not a cookie cutter industry. All programs should be customized and individualized. You want to look at things like family and friends and social support. Those are things that can make or break, especially if they put themselves around people that maybe are going to steer them away from it. That's something you should know in order to help them be more successful. Develop a plan for any lack of adherence in your regular patterns of exercise. A lot of people sometimes are quick to throw their hands up in defeat when something doesn't go their way. You need contingency plans. You need to be reassuring. And then make exercise both practical and functional. So things that they can use that have purpose. So if they can, like bicycling to work, doing some hard physical work, maybe just getting out and doing yard work on the weekends rather than paying somebody. Look, there's nothing that feels better than that, I can tell you. I don't get out to do it anymore because I am simply not home for it. But as much as I hate the idea of cutting the grass, I can tell you that it's hard work and just out there pulling weeds and pushing the mower in the hot sun and you're sweating and heeing and hawing, whatever you're doing. Man, it feels good when you're done, though. Winding things down here, again, exercise as an adjunct to other forms of therapy. Typically, a multimodal therapeutic approach is more effective than just one intervention. So adding it to someone's program of other things. So if they see a therapist, if they're taking meds, make exercise a part of that too. Again, doctor's orders, follow those. Make sure you get those doctor's orders from your clients. And variety. Variety is the spice of life. That enhances adherence to exercise regimen. It allows them to not get bored. Finally, if it's going to be used exclusively as therapy, there are people that are like recreational therapists. That should only be done by recreational therapists, qualified professionals. There's no exact criteria for training have been established, but again, you get those doctor's clearances, you get those recommendations based on issues they have, and if you are yourself are a certified trained person, fitness professional, well then you should be able to use this to work with them. It's suggested that formal training and practical experience in both the psychological and sports sciences are necessary because of the multidisciplinary approach to treatment. So learn a little bit about as much as you can, and you will. I mean, this is the real primary psychology course. If you guys continue in the bachelor's program, when we get into stress management and even with some of the management courses, you'll delve a little bit more into psychology. Not as much as maybe some of you would like or as much as maybe you need. But be a student of the game. Read about how these things affect people because at the end of the day, I've said this before, it doesn't matter how much someone knows about exercise. If they don't want to do it, if they're not motivated, if their will's not strong, if they don't know how to stick with it, then that knowledge means nothing. They're not going to use it. So mind and body, if you're going to be a professional, the best thing you can do is learn as much about both so you can be very effective. That's all I got, guys. Again, make sure you go back, you look for that assignment I talked about. It is laid out in the actual handout I gave you of the slides for this chapter number 17. So go back to those slides beforehand. Listen to what I said, send me that email, and we're good to go. Thanks for watching, thanks for listening, and I'll see you all in class on the next one.